tracheostomy tubes are placed in a tracheostomy in order to keep it open to facilitate breathing. Inside of the outer trach tube is another smaller tube called an inner cannula. The inner cannula is removable and usually disposable, and by removing and replacing the inner cannula, you are able to ensure the patency of the trach tube and limit the risk of developing obstruction. This video will demonstrate the process of replacing the inner cannula of a tracheostomy tube. Trinity Health Livonia stocks the supplies for the Shiley Flex tracheostomy tube. If your patient has a Shiley Flex in place, it will look like this. Replacement inner cannulas are available through distribution for the Shiley Flex trach tube, but if the patient has a tracheostomy tube placed from a different facility, it may not be a Shiley Flex. There are many makes and models of trach tubes, and unless the patient brings their own supplies, there may not be any additional inner cannulas available while at this hospital. If your patient falls into this category, stop watching this video, and instead, watch Tracheostomy Care, cleaning the inner cannula when replacements are not available. But if you have replacement inner cannulas available for your patient, continue watching this video. At Trinity Health Livonia, both respiratory therapists and registered nurses are able to replace the inner cannula of a tracheostomy tube. When should the inner cannula be replaced? This process should be completed at least once per shift, and best practice is to replace them as close to every 12 hours as can be accommodated. An easy way to achieve this is for the nurse to replace the cannula during their assessment at the beginning of their shift. For most patients, it is advisable to perform suctioning prior to replacing the inner cannula. This limits secretions in the airway, and also limits the risk of those secretions spewing from the tracheostomy if the patient coughs during trach care. This process is explained in a separate video entitled Tracheostomy Care, Oxygenation, and Suctioning. The Shiley Flex will look like this. What you see at the tracheostomy opening is called the flange of the trach tube. It is a clear, flexible material that has information printed on it. Right now, the information we need is written below the trach tube opening. It tells the inner cannula measurement. This tube requires a 6.5 mm inner cannula. Make sure you have this size inner cannula readily available. There are supplies required to be at the bedside at all times for trach patients, and inner cannulas are included in this list, so there should be some readily available in the room. The rest of this list is explained in the video, Tracheostomy Care, Equipment and Oxygenation. Now, examine the trach ties and determine if they will need to be replaced. Trach ties only need to be replaced if they are wet or soiled. Before you begin this process, you will need some supplies. Most, if not all of these supplies may already be at the bedside because they are included in the required supplies list previously mentioned. If you use supplies from the room, make sure to replace them as soon as possible after you are done. Like any other time you interact with a tracheostomy, you will need gloves, a face mask, and eye protection. You will also need a tracheostomy care kit, which should be available at the bedside, but if not, is also available in every pod room. Sterile water will likely already be in the room, but if not, this can be removed from the Pyxis. And you will need a new inner cannula that is sized for the tracheostomy tube. As previously noted, this tube requires a 6.5 mm inner cannula, and these should also be available in the room. Open the Trach Care Kit. This kit holds a collection of sterile supplies. This procedure is not considered sterile at Trinity Health Livonia, so it does not require strict sterile technique. However, always do your best to ensure the cleanliness of your supplies, so for this procedure we will practice a high-level aseptic technique that utilizes some aspects of sterile technique. Open the new inner cannula and drop it into the sterile kit. This way the cannula isn't contaminated and remains sterile. Remove and apply the sterile gloves. The next item is a sterile drape. Open the drape to create a sterile field at the bedside table. Now set up your supplies for this procedure. The inner cannula is the most important piece to keep sterile. You will be inserting it into the trach tube that rests in the patient's trachea. We do not want to introduce any foreign bacteria into this space. Your hands are sterile now, so you can touch anything without contaminating it. But when you don't have sterile hands, never touch any part of the cannula that will be inside the trach tube. Only ever grasp from the outer end of the tube. For now, place the inner cannula on the sterile field. Remove the wire brush and the cotton tip applicators. The twill tape will not be used. It is for securing the tracheostomy tube, and we utilize trach ties for that purpose. You can dispose of the twill tape. Separate the split gauze from the 4x4 gauze and place them on the sterile field. Take your sterile water and pour some into one of the sections of the now empty tray. Once sterile water has been opened, it is only good for 24 hours, so if you are opening a new container, time and date it. If the container is already open, check the date to ensure that it is still usable. Now go to the patient. Loosen the trach collar, but do not remove it fully. Secure the trach tube by holding it in place with one hand on the flange, and with your other hand, grasp the end of the inner cannula and squeeze the edges together to release the lock. Gently pull the inner cannula out. Dispose of the inner cannula. Grasp the new inner cannula by the outer end and insert it into the tracheostomy tube. The inner cannula is now replaced, but there is additional trach care that must be done at this time. Remove the split gauze by gently sliding it out from under the flange. Inspect the gauze for secretions. Then inspect the patient's ostomy for any redness, swelling, bleeding, or large amounts of drainage. If any of this is noted, consider a consult for the wound ostomy team. Wet the first cotton applicator in the sterile water and begin to clean the stoma. Then do the same with the second applicator. If necessary, you can use the 4x4s to continue to clean the area or the flange of the trach tube. If the trach ties need to be replaced, perform this step now. This process is explained in a separate video entitled Tracheostomy Care, Replacing Tracheostomy Ties. If that is not necessary, take the split gauze from the sterile field. Tell the patient you will need to press lightly on their neck and gently slide one side of the gauze under the trach tie, and then slide it underneath the flange. Do the same to the opposite side. Ensure the gauze is under the flange on the right, left, and bottom. The split should always be directed up under the patient's chin. Tighten the trach collar and replace it over the tracheostomy tube. Document your intervention in Epic. Also be sure to inform the respiratory therapist that the inner cannula has already been changed for the shift. If you used any of the required bedside supplies, be sure to replace them as soon as possible. Replacing the inner cannula can be completed by either the nurse or the respiratory therapist, and should be completed at least once per shift. The timely completion of tracheostomy care is vital to ensure the health and safety of our patients.